East Coast Community Healthcare is a social enterprise, not-for-profit organisation, and we cover the community of Great Yarmouth and Waveney. The Tissue Viability team consists of one tissue viability specialist nurse and 3 assistant practitioners. We do complex wound care for those non-healing wounds out in the community. The unwarranted variation that we identified was the residential homes were contacting the district nursing service to see patients on the same day for skin tears. This led to increased demand on the district nursing service, and also very often when they did get there they found that it wasn't actually a skin tear that had occurred. The need for change was identified as the fact that we needed to reduce the same-day visits, and also if a wound does occur to a skin tear, the skin dies within 6 hours, so it was quite important that the carers would be able to provide that care immediately rather than waiting for the district nursing service. The skincare pathway started with us looking at our wound care formulary that we have, which is developed with the local CCG. We then decided that actually the most important thing was prevention. So we looked at developing an education package that would go alongside the skin tear pathway.
Initially, we looked at all the evidence that was available to gain information. And then we went on to write and develop a PowerPoint presentation that we could take forward.
The package itself looks at the care of the residents' skin to ensure that they're checked daily. It highlighted those residents that were more at risk of skin tears, and also the use of emollients. We chose 3 particular areas to pilot in 3 different homes.
Myself, the sister of the team, the assistant practitioner and another staff nurse, we met up with the Tissue Viability team and we rolled out the skin tear pathway and how it would work within the care home setting.
We'd take the PowerPoint presentation to the carers in small groups, and we would identify from that what a skin tear is, so a definition of a skin tear, so what the carers were looking for, but then also what to do once a skin tear has happened. The resource box we take into the residential homes for the training session, and within that resource box are all of the resources that are needed to follow the skin tear pathway. Also within that is a checklist for the carers to follow, so that we know we've looked at all of the aspects of the skin tear pathway really.
The care pathway has made me feel a lot more confident in my job role, and also I know the team have felt that it's made them more knowledgeable what to do on shift if we do come across any skin tears or anything like that. So I think that's given us a good boost of feeling more confident of what to do.
I've had very good care. They sort of keep an eye on you, see if you've got any sort of marks, anything you shouldn't have. Any little thing, I suppose they put a little patch on you if you just cut yourself or graze yourself. But they are very quick to notice things.
We did an audit on the pilot of the 3 homes, and there was 26 skin tears that had occurred within that particular 3 months. Out of the 26, 25 had healed. There was less demand on the district nursing service, and when they did go, they were appropriate referrals, and also the dressings themselves had been appropriately placed.
There has been a reduction in the amount of calls that we take from the home. We used to get 2 or 3 calls a day. Now it's probably 2 or 3 calls a week.
The leading change and added value commitment, I believe that we have demonstrated, is commitment to the prevention, because prevention is always much better than cure, and to prevent a skin tear in frail elderly skin is very important because it reduces the risk of infection to that patient, trauma and pain.